So PSMA is the marker PSMA is not only good, or the ligands are not only good for imaging, but also for therapy, and also in combination with lutetium, a better emitting isotope for radioligand therapy. And this has been, I mean, the last few years, it has been so, the field has moved so fast. In 2015, the first images of PSMA radioligand therapy became the image of the year of the Society of Nuclear Medicine and Molecular Imaging. And these first treatments were done in Heidelberg, which really moved the field forward in this regard. And then just last year, we saw two big trials, therapy trial, the VISION trial, and they really established now PSMA radioligand therapy for metastatic castration-resistant prostate cancer. And right now there are approval issues going on, but this PSMA radioligand therapy is really a well-tolerated, safe treatment for those patients. However, and this is where the problems start a little bit, is availability. If you look at the patients that could now receive in those later stages PSMA radioligand therapy, we have a shortage of PET-CT, of access to PET-CT, a shortage of maybe also radiochemicals, a shortage of personnel who's trained looking at the images, providing the therapy. And in Germany, I'm talking mostly about Germany, where we do a lot of PSMA radioligand therapy, a shortage also of beds where patients can be hospitalized for this kind of therapy. And now there are a lot of studies ongoing moving PSMA radioligand therapy, as it's safe, it's well tolerated, and as it is effective, to earlier lines. And we were discussing, for example, the LuTectomy trial, which is really upfront, basically, prior to radical prostatectomy, patients receiving one or then two cycles. This is a small single-arm study. It's great for research. It's great for translational research options that you have. And the Australians, I mean, Declan Murphy and his team are performing this trial together with Michael Hoffman and Renu Epen. He's doing, as PhD student, all the translational research on these trials. And that is great. And of course, it's effective, it's safe, you can do surgery afterwards. However, can we treat our patients, or will we treat our patients in this really neoadjuvant setting with lutetium PSMA? And I'm a little bit skeptical. For once, availability, and this might be challenging, but then right now in this first results, we have seen pathological responses, but we have not seen complete responses. We have not seen minimal residual disease. What we have seen in combination, in hormonal combination therapies, which are given upfront, and there are other trials running, like the Proteus trial, hormonal therapy in combination with ADT, where you can expect to see patients having so very deep pathological responses, which then also translate into better outcomes. And this could be achieved with PSMA radioligand therapy as well. However, right now we have not proof of that, and it still remains the challenge of availability, of simply being able to do so. And I think we have here a very good treatment option, but I think we need to first roll it out basically in the later stages in the metastatic castration-resistant prostate cancer patients, where we really have a great benefit. It's better tolerated than conventional therapies, I would say so.